We make FHIR work for you. Meet regulatory deadlines. Protect patient health information with encryption. GUI to import HL7 and healthcare data encrypted into FHIR, then view and download patient's data. Encryption removes the risks of damaging HIPAA, CCPA and GDPR violations. Save months building graphical interfaces for patients, hospitals, and other healthcare providers to grant consent, review healthcare data and securely download data they are entitled to. Extract from encrypted FHIR files for transmission to patients and providers, coupled with a secure decryption module that only the intended recipient can unlock after successfully entering valid credentials. Here we see raw HL7 hospital feeds that are received unencrypted. We also have an X-ray picture in this input to be securely imported into FHIR. First, we will establish connections to the HL7 messages and then the images path and run a process to copy or move this information into FHIR securely and encrypted. As we see here in the database, we are starting with a patient search from a hospital or facility. We see in the interface it will return as many patients as possible like the requested information is input. It will allow the operator to ask additional questions till they find the precise patient and then they are able to get the patient their proper information. We are able to read the encrypted data with our proxy and APIs, allowing non-encrypted and encrypted data to work business as usual. Now we are establishing a search as a patient. If the patient does not supply enough information, then it will warn them they need to add more personal information till just their patient data is found for a secure download. By adding additional information, the patient has now returned just their one set of information. Now the patient is required to enter their password for the zip file to be transported to their device, as well as the password that will be necessary for decrypting the encrypted secured CSV file for their viewing. If 3 unsuccessful attempts later with wrong passwords, the process will self-destroy and require the patient to restart the process. Next, the user moved the secured zip file to a new directory. In order to open the zip file, they are required to successfully enter the correct password to have access to all the necessary files and the ability to decrypt the encrypted CSV file containing their patient and billing information. Now, in order for the user to decrypt the data and create a new readable CSV file, they must run a delivered process and know this password that will unlock the decryption and new creation process. As you see, if the patient adds the wrong password, they are warned. If this occurs 3 times, the process will need to be started over. After their second try they were successful, and we will open the decrypted CSV of the patient's personal hospital information. Here we see the original decrypted transported patient information file, and next we see the newly created decrypted patient information file after running the secure decryption module. For you more technically oriented folks, we are demonstrating multiple attempts with various methods used to reverse engineer or get access to Java code, the internals of the code, or even hidden files or other information meant to not be seen or used by anyone or any other processes. We feel we have strongly secured our Java file that handles the decryption of the decrypted CSV patient personal information. Save months building graphical interfaces for patients, hospitals, and other healthcare providers to grant consent, review healthcare data and securely download data they are entitled to. Extract from encrypted FHIR files for transmission to patients and providers, coupled with a secure decryption module that only the intended recipient can unlock after successfully entering valid credentials. No need to absorb additional time and expense for Data Architects and ETL resources to reconstruct FHIR's unique data storage schemas so that the data can be accessed and understood. We have already completed these tasks and are ready to support your applications. Automated Healthcare Processing, AHP, is a Spark 3, Java, Spring, Swagger microservices framework and architecture. This will make our processes easy to integrate into container, Docker and Kubernetes frameworks and methodologies.